We want to see a new vision of childhood which supports babies, children, young people and their families to recover from the impact of COVID-19 pandemic. The voices of children, young people and families must be at the heart of the process, and we will need much more investment in the services, support and staff that they rely on.
Recovery must not mean going back to how things were, because we knew that children, young people, families, and the services that support them were already struggling so much. These are the key principles and actions necessary to make this happen.
Number 1, we want the government to develop a children's recovery strategy to make sure that the different leaders in the government, as well as the services in local areas, work together to improve children's lives. Children, young people and parents must be consulted so that their voices are at the heart of the strategy.
Number 2, protect and promote children's rights and entitlements. The UN Convention on the Rights of the Child is a statement that lists all the different rights that children should have. We want this to be at the centre of the government's recovery planning after COVID-19.
Number 3, value children, young people and their families as partners. We think that the government must value the experiences of different communities and listen directly to the views of children, young people, and parents themselves, so that recovery is planned in partnership with them.
Number 4, focus on reducing inequalities. We think that the government needs to really think about why COVID-19 has affected particular groups more than others, for example, Black and minority ethnic communities. The government needs to provide enough funding to public services to make sure that inequalities do not get bigger and that child poverty is reduced.
Number 5, invest in children and young people's futures. Public services did not have enough funding before COVID-19 and are now expected to help the extra people who have been impacted by the pandemic and the lockdown. These services need long-term funding and help to make sure that they can continue to work with each other to help children and families.
Number 6, understand how children and parents' needs have changed and take action. So many children and families were not having their needs met even before COVID-19. So now it's really important that the government and local areas spend money and time researching how these needs have changed.
Number 7, value and invest in staff that look after children and parents. We think that the government should take steps to protect the physical and mental health of the staff and volunteers that support children, young people and families during recovery. We also want staff to be supported with new training to help them work with children and families in new and better ways.
Number 8, value strong relationships and focus on the needs of the child, young person or parent. We think that the government and local services need to recognise that online support has worked for some children, young people and parents during lockdown, but it hasn't worked for everyone. Sometimes face-to-face meetings are what's needed to develop and maintain strong relationships. So we should ask children and families what they want and let them choose how they receive support.
Recovery must not mean going back to how things were before, because we know that children and families and the services that support them were already struggling so much.
Let's make a change.